Every individual with a traumatic brain injury is different. They can present with a variety of different symptoms. And the challenge often is that those symptoms, there's no symptom that's completely specific for a brain injury. So it may be due to a mental health issue, it may be a pain issue that's kind of driving that symptom. The real key then in the rehabilitative process is to look at the individual and see how those symptoms are affecting their functioning. And then you can try to help work with the veteran to develop a treatment plan that's going to take into account their individualized needs and what they really would like to focus on and how it affects their function. So for instance, if it's really a cognitive issue or a memory issue that they're the most concerned about, then we'll try to kind of focus our efforts on that. That may include a short course of speech therapy, to see the speech therapist for cognitive therapy. It may be when talking with the individual, they may not be able to concentrate because they may also have post-traumatic stress and they're hypervigilant and not able to, focus their attention because they're too worried about what's happening outside the room or what was that noise outside the door. So it really is very individualized as far as how to kind of develop that treatment plan. Some of the treatments, though, are the same, and it doesn't really depend so much on the actual diagnosis. So if it's an attention issue, we can work on some cognitive therapy to focus on improving attention. We can provide techniques as well as technology. So some of the techniques may be using a post-it note to remind an individual of an appointment, or it may include using a smartphone to schedule your appointments to remember what you need to do during the day or during the week. So it really is very individualized. It's also important to talk to the individual and see of all their symptoms where you might get the biggest bang for your buck in regards to treatment. So for instance, sleep issues are very common, and certainly if you can help to improve sleep, then you're likely going to improve memory and concentration, likely to improve overall pain or at least tolerance of pain, and overall function and mood certainly. And so that will impact not only the individual but their functioning and how they interact with their family.